Now let us demonstrate the deep tendon reflexes in this patient. Here we see the biceps jerk. When the patient is in supine position, we have to place the arm over the trunk, and then we have to place an index finger over the biceps tendon. We have to palpate the biceps tendon and place the index finger over the biceps tendon, and we have to give a small gentle jerk. So we can see the flexion response, flexion of the elbow joint with contraction of the biceps. So here clearly we can see the biceps contraction with flexion of the elbow joint. The root value for the biceps jerk is C5 and C6. Now let us demonstrate the triceps jerk. So here the patient arm is placed over the trunk and a gentle stroke is given at the triceps tendon. So here we can see the extension at the elbow joint with contraction of the triceps muscle. So here we can see here you can appreciate triceps contraction with extension of the elbow joint. The root value is C6, C7. Now we will demonstrate the brachioradialis jerk or supinator jerk. The root value is C5, C6 radial now. Here we should give a gentle stroke 5 centimeters above the wrist joint. The patient arm should be placed over the trunk as that of and should be in mid-prone position. The forearm should be in mid-prone position, and we have to give a gentle stroke 5 centimeters above the wrist joint. So here we can see flexion at the elbow joint with contraction of the brachioradialis tendon and finger flexion. Again you can see the reflex. Patient forearm should be in mid-prone position. So here we can see the brisk brachioradialis jerk with contraction of the brachioradialis muscle with flexion at the elbow joint and finger flexion. These are the components of the brachioradialis jerk. Now we shall demonstrate the knee jerk in this patient. First we have to expose the thigh up to mid-thigh. Up to the level of mid-thigh we have to expose, and we have to lift them. When the patient is in supine position, we have to lift and place the leg above the forearm of the examiner, and we have to give a gentle stroke at the patellar tendon. So here we can see the brisk knee jerk, exaggerated knee jerk 3+, where we can see the contraction of the quadriceps muscle with extension of the knee joint. So here you can appreciate the contraction of the quadriceps muscle. The root value for knee jerk is L2, L3, L4, that is femoral nerve.
Start.
Now let us see the method to elicit the patellar clonus. The patella is gently grabbed between the two fingers, that is thumb and the index finger of the examiner, and we have to push the patella from above downwards in a sudden jerky fashion. So if it is positive, the to and fro oscillations of the patella can be appreciated. Greater than 3 oscillations, to and fro oscillations, is considered to be positive for patellar clonus. Let's demonstrate the ankle jerk in this patient. First we have to flex at the knee joint, and hip joint should also be flexed, and the sole should be dorsiflexed, and we have to give a gentle stroke at the Achilles tendon. So here we can clearly see the contraction of the Achilles tendon with plantar flexion. The reflex is plantar flexion of the feet with contraction of the Achilles tendon. Here we can easily appreciate. So here we can see the plantar flexion with contraction of the Achilles. So the root value of the ankle jerk is S1, that is medial popliteal nerve. Here there is when we do ankle jerk, there is a sluggish and slow contraction of the Achilles tendon. The sign is called hung up reflex, and the sign is Volkmann sign. There is a delayed relaxation of the tendon with a sluggish reflex. This is hung up reflex or Volkmann sign we see in hypothyroidism. It is also called as myxedema reflex. Now let us demonstrate the ankle clonus in this patient. First we have to flex at the hip joint with flexion at the knee joint, and we have to firmly hold at the thigh, and we have to give a sudden jerk at the ankle. So here we can see the ankle clonus. When it is greater than 6 oscillations, 6 downbeats, then it is considered as significant, ill sustained. When it is less than 6, it is ill sustained. When the downbeats are greater than 6, then it is called sustained ankle clonus.